Assalamualaikum warahmatullahi wabarakatuh and good morning everyone. Today, I will present a topic that addresses a growing challenge in Malaysia, the rising burden of non-communicable diseases NCDs such as diabetes, heart disease, and cancer. These illnesses are placing significant strain on our healthcare system and affecting of many lives of individuals. The title of my presentation is Integration of NACLI and ACLI in Health Insurance, planning to address non-communicable diseases in Malaysia. This topic resonates deeply with me because it combines two critical frameworks. First is ACLI. ACLI is a logical and rational reasoning which emphasizes contemporary solutions and evidence-based approaches. Second is NACLI. NACLI is revealed knowledge and spiritual value rooted in Islamic teaching which align with Malaysia's social, cultural, and religious context. By integrating these two frameworks, we can craft a more inclusive and culturally sensitive approach to healthcare. Specifically, we will examine how this integration can enhance health insurance system, making them more effective and accessible for those impacted by NCDs. In this presentation, I aim to explore how a fusion of rational economic models with Islamic values can provide solutions to address NCD in Malaysia. This approach not only aligns with our social value, but also has the potential to improve the quality of life for many. Let's dive deeper into this concept, starting with the background of NCD and their impact on our healthcare system.
Non-communicable diseases or NCDs like diabetes, heart disease, cancer, and respiratory problems are a growing concern in Malaysia. They are largely caused by unhealthy lifestyles such as poor diets, lack of exercise, and smoking. These diseases not only affect people's health but also increase healthcare costs and lead to productivity losses. So, to address this, we propose a new approach by combining NACLI, which refers to Islamic teachings, and ACLI, which is logical reasoning. This framework aligns with Maqasid al-Shari'ah, which is focusing on preserving life, health, and wealth. It emphasizes preventative care, ethical financial practices, and encourages healthier lifestyles. This makes it both scientifically effective and culturally meaningful for Malaysia's diverse population. Our approach shifts the focus from treatment to prevention and early intervention. By offering financial incentive for healthy behaviors such as regular health screenings and participating in wellness programs, we aim to reduce the prevalence of NCDs and ease the burdens of our healthcare system. This approach also ensures healthcare equity by improving access, especially for undeserved and marginalized communities. By reducing financial barriers and incorporating culturally appropriate strategies, we can improve health outcomes for everyone while fostering inclusion and fairness. In conclusion, this approach provides an opportunity to design sustainable and culturally relevant health insurance policies. It's a model that not only addresses Malaysia and NCD's challenges, but can also inspire other countries with similar socio-cultural contexts. By integrating NACLI and ACLI, we can create a healthier, more inclusive future for our nation.
There are some findings related to integration of NACLI and ACLI in health insurance planning to address non-communicable diseases in Malaysia. Non-communicable diseases NCDs such as diabetes, cancer, and cardiovascular diseases are a growing health problem in Malaysia. These diseases cost the country more than 9.65 billion ringgit Malaysia annually, WHO 2022, and are mainly caused by unhealthy lifestyles, habits like poor diet and lack of physical activity. To address this, combining NACLI, Islamic teachings, and ACLI, logical reasonings, offers a unique and effective solution. Islamic teachings highlight the importance of protecting life and health. For example, the Quran advises against overconsumption in Surah Al-A'raf, sentence 31, and encourages people to care for themselves, Surah An-Nisa, sentence 29. These principles support the idea of preventive care like regular health checkups and promoting healthy habits. By offering financial incentives for wellness programs, Malaysia can move away from focusing only on treatment and instead prioritize prevention. Additionally, this approach emphasizes fairness and helps marginalized communities access health insurance. Ensuring everyone gets the care they need aligns with Islamic principles such as helping those in need. Surah Ali Insan sentence 8 by reducing financial barriers. This strategy ensures that more people benefit from preventive care. Overall, this approach provides practical and sustainable way to handle Malaysia's NCD problem. It is not only reduces healthcare costs but also encourages better lifestyles. By combining spiritual values and logical planning, this framework can improve the health of individuals, communities, and the country as a whole.
Unanswered question. First, effectiveness of integration. How can health insurance policies effectively integrate NACLI and ACLI to create comprehensive coverage plan for NCDs? Second, policy implementation. What challenge exists in implementing health insurance policies that reflect both NACLI and ACLI perspective, especially within a diverse society like Malaysia? Third, Sharia compliant health insurance models. How can the current model of Sharia compliant health insurance be improved to be better address the rising burden of NCDs while still aligning with Islamic principles on health and well-being?
Increasing prevalence of NCDs such as diabetes, heart disease and cancer has placed a significant strain on the healthcare system. Traditional health insurance models, often driven by economic logic, may overlook Malaysia's socio-cultural context. By combining Islamic principles with modern healthcare practices, this approach aims to create a more inclusive, accurate and culturally relevant insurance system, enhancing accessibility for those affected by NCDs.